Hi, everybody.
Hi. We are live today with our sponsor, ProCare Health, and we're talking about the most common causes of fatigue and how to overcome them. So, we welcome you if you're joining us. Tell us hi and let us know that you're there. At the, so, um, so, so today, basically, we have a special little presentation, and it's going to be basically on talking about being tired and all of us go through periods of time where our energy levels are a lot higher than some other times, and so we thought this would be a great topic, especially for bariatric population. There's different phases of what you go through and your energy levels, and so hopefully this will be really helpful. So before we start, we want to say that we're joining on both Facebook Live on the ProCare Health page. And if you're joining from there, give us a shout out and wave to us, say hi. And if you're joining on Crowdcast, be sure and say hi. We have a forum that we'll post a link to in both places. And it's to our Crowdcast channel. If you follow us on there, you get notifications right before events start. And so you can watch us. You can come on live with us, or you can always watch the replays. The replays are always available there too. So we probably got about 50 different topics now, including our support groups. We do weekly lives, and also we do monthly support groups. And so it's a great place to join a bariatric community. We love having you here. And looks like Deborah says hello. So hello.
I did want to say real quick that unfortunately, I don't think that the live is streaming on Facebook, but as soon as we're done, we'll upload it afterwards.
Okay. Thank you,
So for
Brittany.
anybody, no problem. I don't. Facebook changed some settings apparently, guys, so just bear with us. We're trying to, you know, learn as we go, I
Learn.
guess.
Yeah. Yeah. Oh gosh. Well,
That's
um,
okay.
let me see if I can post the link on the Facebook page real quickly to share that so that people can join us if they're looking for it. So, okay. Okay, so let's just get started. Let's have fun here
Okay.
and go for it. So, I'm going to share my screen. You're going to see me kind of. Whoops.
It's just me.
It's
No.
just you. Okay, well, let me kind of go back here. Can you hear me, Brittany?
Yeah.
Okay. I think it's. Let me see if it'll let me. Okay.
I can share my screen too if you need me to.
I think
Oh,
I got it here, but I kind of
yeah.
wonder. Let me untoggle this video. Up. I'm gonna bring us both back here for a while.
Okay, I'm
We're
still
having
here.
fun, and now let's try this so that we can be on video as well during the what I'm sharing here. So I'm gonna go down and going into present view here. Okay, can you see this, Brittany?
Yes.
Can you see? It says the most common causes of fatigue and how to overcome them.
Mm-hmm.
Okay, perfect, perfect. So basically, we're going to make this kind of easy here. We're going to be introducing me and Brittany. For those of you who don't know me, I have been with ProCare Health. It's been a year now. I got my little anniversary date on my calendar. And we've been doing these Facebook lives weekly and also doing monthly support groups. So we're also kind of talking to bariatric facilities and patients and helping to learn with them what how we can support each other with
Mm-hmm.
all of that. So that's a little bit. In our topic today, sometimes it does take Fatigue can be very challenging because there's such a number of factors involved. It can be so many different things. So, like knowing what medical history and lifestyle habits, understanding what those are and how those can be contributing to the issue can also be very helpful. But once you find out, what's going on, it'll help. The awareness can help you find out what your next steps are and how to basically change things to raise up your energy levels. And Brittany, did you want to say anything? I know I didn't even give you an opportunity to introduce yourself.
That's okay. Yeah, for those of you who might be new, my name is Brittany, and I've been with ProCare, full time, it'll be a year in August, I believe. So 2 more months.
2 more
Well,
months.
actually like a month, really, because June is pretty much over with. I can't believe that. But yeah, so like Brenda said, I love to do these support groups with you guys and the live events weekly. This is literally my favorite part of my job that we get to do together, and it's just because we get to interact with you guys and get to know each other a little bit better. And yeah, so if you ever have any topics that you would like us to discuss, maybe a little bit further that we haven't talked about, you can always use the chat feature and suggest away, basically.
Yeah, yeah. We're always looking for new topics and new kinds of ways of doing things. So we're always open to all of those things. So we
Mm-hmm.
appreciate all those. And we already kind of did a check in as far as saying hi. But let us know how you're feeling. Is your energy level high today? Is it low today? Are you feeling? How are you feeling today? Give us a little emoji. That's kind of a fun way to check in.
Oh, yeah.
And tell us where you're from. What if you've had weight loss surgery, how much weight you've lost, anything. It could be your best non-scale moment, anything you want to share. So, and I am gonna, okay. So anyways, I had another message coming through that I wanted to make sure and catch. So
Okay.
got that. So are we ready? Let's get started. Let's just have some fun. So the most common causes of fatigue and how to overcome them. We're going to be talking about actually 6 different things. The first one, vitamin deficiencies. The second one, sleep problems and sleep apnea. The third one, some metabolic conditions, including the endocrine system and that type of thing. The fourth one we're going to talk about is mental health. The fifth one is intake, like foods and medications. And the sixth one is lifestyle habits.
Mm-hmm.
So, let's get started. The first one, and that one is vitamin deficiencies. And Brittany and I was talking just before this came on that our bodies go through all different kinds of adjustments, and it is important to kind of take a look at your vitamin levels. I just recently had mine checked to make sure that everything was going okay because I kind of had a crazy year so far, and so I wanted to make sure I was in check, and all of that was pretty good. But there are some things that, like, to monitor for if you are a bariatric surgery patient, if you've already had surgery or you're preparing to have surgery. A lot of times, even before surgery, the doctors will do a baseline testing of your vitamin labs to make sure that everything's okay, before going into surgery, so that they can try to work with you a little more on any issues that might be going on. Maybe you need a little extra more than just a regular, bariatric multivitamin. So some things that can cause fatigue or drowsiness is, number one is anemia or iron deficiency. And a quality bariatric multivitamin with iron is helpful. Most of the time, most people are recommended 18 to 45 milligrams per day, up to 45, especially if you're a female that still has like menstrual periods, or you have had any history of anemia, or you have some bleeding issues. So those are all kind of iron recommendations. And then the second thing is B vitamins. And I know the bariatric surgery program that I used to work for, it was very common for patients to be on like a B complex shot monthly. A lot of vitamins do have oral B12 or B complex in them, B1, B6, and B12. There's some other B vitamins as well. Those are the most common that I'm mentioning. But So you can find B vitamins in a vitamin form, like the ProCare Health, which is our sponsor, does have B12 in their one a day multivitamin, which is in the capsule and the chewable, but they also have a sublingual formula, like if your body's not absorbing it well. So there's a couple different options there. Sometimes people will get injections as well. That's the IM formula. That usually goes through your physician's office if you require an IM injection. And then the third thing is vitamin D. And I'd say vitamin D overall is probably one of the most common vitamin deficiencies. Probably, I would even venture to say as many as maybe 75% of people. That's high, I know, but going in to have weight loss surgery would have a vitamin D deficiency. Some ways to add extra vitamin D is sunshine, okay? Fortified, milks and cereals and things like that. A lot of them will have extra vitamin D as well. Sometimes yogurts and things like that. But also if you take a calcium supplement. So calcium supplements do tend to have are paired with vitamin D because they help each other with the absorption. And so if you take a good calcium supplement, then likely you are also getting your vitamin D and helps with absorption there as well. And then magnesium. And we actually did a ProCare Live on magnesium, the super the super vitamin. And we can post a link here just shortly regarding that. That was kind of a fun one. Magnesium has so many benefits. The normal for women is 310 to 320. For men is 400 to 420 milligrams. And if we have any teenagers in here, boys or girls, 360 to 410. So magnesium is just an incredible thing to have on hand.
It has all kinds of benefits.
Absolutely. And ProCare has one of the highest, their formulas are formulated to be higher than a lot of other bariatric formulas in magnesium. So it's a great way to get your magnesium in. And then the last thing here is potassium. And potassium rich foods, you can also get it in some of your, fluids as well. Sometimes electrolyte shakes and things will have potassium, but foods includes things like fruits, nuts, beans, and that type of thing. And potatoes is a great way. I know potatoes, sweet potatoes and regular potatoes, and bananas. So I have a little picture of a banana there. And so those are all great ways to help. So before we go on, any comments, Brittany?
Yes, I was actually just getting ready to say something.
Okay.
Hi, Carrie. Thank you for commenting, and thank you for coming. She said, hi, I had gastric sleeve September 2015. Her high weight was 301 pounds in 1999, and the beginning weight was 269 pounds. And the date of surgery weight was 221 pounds. Wow. So you...
Oh my gosh, that's incredible.
Wow. Lost... what is that? 80 pounds? Am I doing my math right? I don't math good. Weight date of surgery was 221 pounds. So yeah, 80 pounds before. And then her low weight was June 2016. She was 156 pounds. That's amazing. Total loss was 113 pounds and a regain of 60 pounds. And then it looks like she lost 40 more pounds during the pandemic, which that's pretty amazing. I think a lot of people had the other outcome. I know I did. She said she was just diagnosed 2 months ago with anemia, and she has an appointment next week with the gastroenterologist to discuss treatment. Unfortunately, I think it can be kind of common, especially for us women. It's hard.
Yeah. I'm glad you're getting to see a specialist and
Me too.
somebody to help with that. And sometimes, if the anemia is progressed enough, or if you're not absorbing well for one reason or another, there's lots of reasons for anemia. It could be, that you have bleeding, or that your body's just not producing the red blood cells and that type of thing. Or it could be that, there's just a lot of different things, but I would just say that I'm glad you're getting it checked out, and hopefully they'll be able to help, and hopefully that'll help with you if you're having low energy levels, because anemia can be a huge cause of that. So we're glad you're here and listening to this, and hopefully this will help some too. And then next we're too, and thanks for commenting as well. We love hearing
Yes.
comments. Next, we're going to talk about sleep problems. And I mean, I can really understand this one. Anybody else? I mean, sleep is probably one of those huge things. If you're not getting enough sleep, you can definitely tell during the day, usually feeling sleepy. And one of the things that kind of came to me as I was preparing for this too is, and I want to mention it, I think sometimes too when we get really tired and our bodies are just exhausted, we have a tendency to want to push ourselves. And I don't know if anybody else is like that. I don't know, Brittany, if you're like that. But
Yeah.
like, I just want to try to get everything done that I want to get done. I have this passion for life and I just want to keep going and keep moving forward. And sometimes our bodies are just like, okay, you need to slow down. You need to slow down and just rest. And if you don't, then things take a little longer to get over. I mean, your body, can heal as fast. Were you going to say something else, Brittany, about that? Or
I was gonna say even mentally, myself, we were actually just talking about before we got on this call that we both got our COVID vaccines, and Brenda said that she had some fatigue after her first shot, and I did with my second one. And it's just for me, when you're fatigued and you're tired or you're having problems with sleeping, it's not just physically, it's mentally too.
yes.
It's hard to concentrate. I mean, I'm just talking about me personally. It's hard to concentrate. It's hard. It's sometimes it's hard to even have like a conversation with someone. Something so
Hmm.
simple. And it can be so frustrating too because does anybody else ever get so tired too, but you're so tired that you can't sleep? Because that happens to me.
I know. And then
Not a
it's like
lot,
you push
but
yourself. Like you push
it's
yourself to try to fall asleep and there's nothing you can do.
yeah, it's like overwhelming. It's your mind is just like overloaded, I guess is the best way to
Hmm.
describe it.
Absolutely, yeah. I totally know what you mean there.
And
Um,
restless leg syndrome is no joke. I used to I used to make fun of my husband for it, and I won't be doing that anymore because I actually have been getting having issues with that as well too. Do you ever get that, Brenda?
no, not really. I've had like leg cramps before, like low potassium or something like
Yeah.
that, and have like my leg twitching, and that hurts so bad.
Hmm. Like a Charlie horse.
Yeah, but I've not had restless legs. So that's one of on our slide here, that's one of our ones. Tell us about what that's like.
It's just annoying because it's like you're trying to relax, your whole body is relaxed except for your legs, and you can't fight the urge to move them. It's kind of like having a like fidget or I don't know how else to describe it, but it's like you just can't your legs can't get comfortable. So you have to like constantly move them around in order to try and get that level of comfort.
Oh,
And it's only like when you're right about to fall asleep too. Your whole body is just comfortable besides your legs, that you just can't make them happy. So,
oh,
um, Carrie did just comment again too. She said my gastro, not my bariatric surgeon, diagnosed me with anemia. I had an upper endoscopy and colonoscopy last week. No internal bleeding. That's
that's
good.
good. Yeah.
Food and pathology came back with no abnormalities. I'm anticipating having to have iron infusions.
You'll probably notice a huge difference, I bet, after that.
Yeah.
Hopefully. We hope that helps you feel better.
And are you taking, just out of curiosity, were you taking a bariatric vitamin that had iron in it? Or were you just
Yeah.
taking one that didn't have any iron in it? Or were you taking maybe just a regular multivitamin that wasn't specifically formulated for bariatric? Not bariatric, but multi with iron. I wonder if maybe there just wasn't enough iron in because some of those multivitamins don't have very much in them. Um, but either way, we really hope that you get to be healthy again and start feeling better.
Yeah, yeah, absolutely.
What's
What's recommended? So I'm gonna answer that, and then I'm also gonna start answering this question that you posed also to Carrie about seeing your doctor and blood work. So
yes,
the amount of iron that's recommended for bariatric surgery patients is 18 to 45 milligrams per day. Depending, 18 would be for anybody. 45 milligrams would be for those who have had a history of anemia or have bleeding issues internally, or like in the past, maybe like heavy menstrual periods or that type of thing. And so about 45 probably for you. And then also, should you be seeing your doctor to do blood work, and what kind of doctor? Honestly, bariatric surgeons can order that for you, or your primary care doctor. I know our physicians that we had ordered a panel of probably about 15 labs. It was a CBC, which was a complete blood count, to check for your white blood cell levels and your red blood cell levels, to make sure, kind of checks, helps with anemia. Profile checks your electrolytes, your blood sugar, your kidneys, your liver. And then the labs for vitamins would be things like B1, B6, B12, vitamin D. We did the copper, zinc,
probably iron too, right?
iron levels, iron binding capacity, magnesium. I know I'm probably missing some in there. Anyways, lots and lots of different things. And it looks like Deborah mentioned something too. Do you want to read that?
Yeah, she said I had issues as well, then started the bariatric vitamins and now no longer low on iron. I'm feeling so much better. So, Carrie, what I'm gonna do for you is I'm gonna send the link to, since ProCare Health is our
Thank you.
sponsor, I'm gonna send a link for you to get a free sample. And if you want to include in there that you would like to try the 45 milligram iron, you can either I'll just send you the link, okay? And it'll be you can get a free sample for that, and you can at least see if you like the product first. Because it sounds like you probably need a product that has more iron in it, and probably a bariatric specific vitamin would probably be better for you too. Um, and then Brenda, I was going to ask you a question actually too. So you were talking about all the blood panels that they do. How often do would you say that bariatric patients after surgery should be getting that blood work checked?
I'd say at least once a year, unless there's, really large abnormalities, and then checking more often than that, depending on, what it was and if there's anything worrisome. So, yeah, at least once a year would be at least recommended. Now, that first year after surgery, different surgeons do different things. Some might check them at 3 months, 6 months, 9 months, a year. Some might just do 6 months, a year. It's kind of different depending on what program you go through. And if you don't have a bariatric surgery program that you're really closely associated with, even your primary care could order those or find out what labs would be, needed. And then, two, it looks like there was another comment here. My sleep apnea was resolved by surgery, but I would have insomnia, but now I take Ambien as needed. Yeah, that's the sleep apnea thing. I'd say a huge number of people sleep apnea resolves after weight loss surgery, so that's wonderful. And usually with sleep apnea, we're going to kind of go into some of our sleep problems, and that's the second little bullet point there. What I will say about that is that after having weight loss surgery and having lost weight, what a person can do is, once they kind of get closer to their maintenance weight, maybe it even if it's just a huge amount of decreased weight, and you're noticing differences with your sleep patterns, and you don't think that the machine is really needed anymore, you can talk to your doctor. Sometimes too, the machine needs readjustment with your straps and stuff as you lose weight, so a lot of times staying in touch with your doctors for that. But a lot of times they will have to order a repeat test to see if it's still needed. So you would have to go through your doctor, to do that, to see if you can stop the sleep apnea machine after surgery. But side positioning can help. Sometimes I know when my husband, he snores sometimes, and just have to have him move on his side. That can help with opening your airway a little bit. Certain things like certain medications Alcohol can actually decrease, even though it makes you drowsy. It can cause sleep interruptions and make you have kind of a deeper sleep, but just kind of more wakeful, I guess. And then we talked about weight loss and the CPAP, both of those being helpful. Insomnia, which is the trouble getting to sleep or staying asleep. Sometimes some things that can help with that are developing a bedtime routine, medications, relaxation techniques, avoiding alcohol or caffeine close to bedtime. I think one of the biggest things that I did, and I think I have it later on one of these slides, is, sorry about all my little pop-ups, guys, is basically is taking all the electronics out of our bedroom. My husband always liked to watch TV and at bedtime, and we had a tendency to leave the TV on, and I took my computer out of my bedroom, I took my TV out of my bedroom, and that just made it so peaceful and so quiet in there. So those are, and then we didn't talk about narcolepsy, but that's this causes you to suddenly fall asleep at any time, no matter where you are. So scheduled naps, some medications possibly could help. But it can be kind of dangerous, just like falling asleep in the middle of a conversation or falling asleep while you're driving, which can be really dangerous. I know I had a friend whose son died of falling asleep at the wheel, and it's probably more common than we think. It's actually being deprived of sleep and driving. It can even be more dangerous sometimes than alcohol or drugs.
I've heard that. Yeah. There's one thing I wanted to add real quick, and I was replying to Carrie, so that's why I wasn't on it right away. But taking out your devices, like Brenda said, is a really good way to just kind of shut your mind down and unwind. And then another thing too that I found is a white noise machine, or have you ever heard of those? I think that's what it's called.
Yeah.
So it just you can change the sounds and the volume obviously too. And there's all kinds of different ones, like the sound of like an ocean, like the waves, which that one's my favorite. Or there's some people really like the sound of rain hitting a window or the roof. It can be kind of it can just make you feel more comfortable and relaxed, I guess. Like today it's very gloomy here. To be honest with you, I could fall asleep. Not right now. Just earlier I could. But yeah, like check into a noise machine too. I know that people, my husband, I have to laugh because he makes fun of me because he said that he thought that they were for children and babies. I'm like, no, they're for adults too.
I saw them at Best Buy the other day whenever I was there.
How much was it? I got mine on Amazon. I don't even remember how much it was.
I don't even remember. I didn't really look at the pricing, but it had like a tester, like that you could push a button on the wall and like listen to the different kinds of sounds that it had. So I stood there and listened to the different sounds for a little while. It was kind of fun. But we'll go ahead. We'll go on to the next subject here. Medical conditions causing fatigue, and it looks like we have a comment. We have a fan run around year round, and yes, Deborah, you are right. I know I have a lot of people, a friend, and my son. They all love having fans, and like when they go on vacations or trips, they bring their fan along too, just so they have that.
I can't sleep without a fan.
So do you bring it along, like even when you're camping and doing all that kind of stuff, Brittany?
Not usually, no. But to be honest with you, I'm not a big camper. My idea of camping is a cabin. So hopefully there's a fan already in there. But I know that there's some people that don't like it at all. Like my mother-in-law hates the feeling of air being blown on her.
Uh-huh.
Which I don't know. What do you do when you get hot?
Exactly.
How do you sleep? Like, I just don't get it. Two different kinds of people, right?
And once you get used to it, it's kind of like that little bit of white noise that you need.
Yeah.
Oh, okay, guys. Well, we'll kind of look at here at our little screen here, the different conditions that might be causing fatigue. So, we're not going to go in a lot of depth here, and sorry about this extra little square here. It looks like that was on my slide for some reason, but we'll just kind of work around that. It looks like we have exercise as being, fibromyalgia as being the first one here. So kind of widespread pain and tenderness. And I could say that's a pretty common medical condition for a lot of people, especially those that undergo bariatric surgery. It's kind of just a box that they put around a lot of times people that have just like this generalized discomfort or pain. And it can definitely, cause poor sleep qualities and things like that. So medications can sometimes help. Some stress reduction, some physical activity can sometimes help with that. The second one here is hypothyroidism. So one of the biggest things for people who are undergoing weight loss surgery is having their thyroid checked. It's actually a requirement for people having that done because your thyroid is what helps with your metabolism. So if your thyroid is off balance, it can definitely affect your weight loss or weight gain. So if you haven't had that checked in a while, I would really recommend it. The thyroid, if it's underactive or overactive, underactive would be a hypothyroid. Hyperthyroidism is kind of like a lot of times people who tendency you'll see who are underweight and who have this really high metabolism and it's just really going fast. Hypothyroidism is when your thyroid is working under what it should be. And so a lot of times that will pertain to weight gain too as well. So if you're noticing sleep issues or you're noticing that maybe your weight is stalled and you don't have a real strong answer for that, that could be something to have checked out. The next one here is lifestyle and diet. And so with that, we have, I'm reading my top right under the 3, but actually it's right below that. This right here where it says diabetes, blood sugars run high. So this is like the ways to combat right up here in this little circle. So we're actually looking at this part right here. So diabetes. And diabetes, what happens is the reason why it can cause sleep fatigue or lead to that is because the blood sugars are unstable. When your blood sugars, when you're diabetic, your blood sugars can tend to run more high. And really just kind of keeping a check on that and keeping your blood sugars at a more stable level can help with your energy levels. So lifestyle changes, possible medications, checking your blood sugars and that type of thing and keeping track of it. And then number 4, fluids, diet, and electrolyte and abnormalities. So if your electrolytes fall low, now this can be due to a lot of different reasons. Sometimes medications, especially if you're on diuretics and things like that, that can lead to it. Or if you're really heavily involved in activities outside, this time of year is really pretty much known for that. You get outside and you're sweating and your electrolytes can come out of whack pretty quickly. And so keep an eye on that. Diets, your fluids, your type of diet you're eating, and supplementation can definitely help with that. And then number 5 here, we're going to go down here, chronic pain. And, for many people, this can be a real issue, long-term pain leading to high levels of fatigue. And, there's probably lots of things that could be done, pain medications, obviously, but things like relaxation techniques and just really a lot of self-care, whenever you kind of get into those spaces where the pain is even worse than other times. Maybe you're dealing with long-term pain. Number 6 is liver disease. And when you have an inflamed or irritated liver, I'm trying to move so that this it's not covering it up. I apologize, guys. It's kind of covering up the slide a little bit there. But things like with lifestyle modifications, possibly alcohol can contribute. Your liver is like the body's filter, and it helps filter out the impurities, and sometimes when it's not working properly, those impurities can kind of get kind of stagnated in there. So getting the liver to function more properly. A lot of times people who undergo weight loss surgery have had issues because of the body being, the liver being a filtration system. Sometimes they will have what they call a fatty liver, and a fatty liver can actually also increase your risk of having some liver disease and some issues going on with that. So lifestyle modification, if you do have lab work done on a yearly basis, a profile which checks your electrolytes, your blood sugar, your kidney, and your liver function can be really super helpful. I mentioned that a while ago when we were talking about the vitamin labs. And then the next thing here is Cushing's disease. And Cushing's disease deals with people who have hormonal changes. And one of those hormones is the levels of cortisol in the bloodstream. And so if sometimes the levels will get very high, and it affects weight distribution in the body in different places, usually like an abdomen that's kind of more full, kind of thinner arms and legs, kind of a more full face. But the things that can help with Cushing's is basically just, I mean, there are medicines, but also stress reduction, better sleep, diet, physical activity, sometimes even surgery with that one. And then the last one here we're going to mention is celiac, which celiac disease is basically an immune reaction to eating gluten or proteins found in wheat, barley, and rye. So a gluten-free diet could be helpful with that. And we're going to kind of move on. Any questions regarding that? I'll kind of go back just until we...
No, not that I see yet.
Okay. And then number 4 is mental health. And I think, to me, this is really, any medical condition kind of leans back to increased stress level, in my opinion. Like, yes. I think it's the root of a lot of things. You know, it can be not just mental health, but we're talking emotional health, physical well-being, you know, overall. When you're not doing well mentally or emotionally, it leads to a lot of physical conditions. So if you feel like that you could benefit from talking with somebody, you know, find a professional. You can even find a friend. If you don't have a friend or someone that you feel really comfortable talking about your deepest, darkest things going on, find somebody professionally who can help you and can help you take the steps that you need to feel a little better. And the same with anxiety. You know, with a lot of things that's happened over the past year, a lot of people are feeling a lot of anxiety. And sometimes I think it's not just you yourself feeling it. It's like a pandemic in itself, if that makes sense. You know, when there's so many other people worrying out there and you're a very sensitive individual, you can feel that. You can feel that anxiety and intensity. I don't know if anybody else has noticed
it's
that.
Kind of like a domino effect.
Yeah. So reach out and get help if you feel like that you could benefit from that. And then the next thing here, we're going to talk about number 5. We have 6 of these, so we're on number 5 is intake. And we're talking about diet medications. And basically, has anybody, before I even start reading some of these, I mean, have you ever eaten something and then thought, oh my God, I feel like I just want to go to bed. I'm so tired.
Mm-hmm. Pasta.
Oh yes. What it does is it raises your, can raise your blood sugar levels, and it just puts you in this sleep state. Another thing is too, when you eat something, for a short period of time after, your body is working to digest that food, so blood is being diverted to your stomach. And when that happens, it actually is diverted away from some of your other organs, including your brain. And so you kind of get this mental sleepiness because of the diversion of blood to your stomach to digest. It kind of causes you to be sleepy. But that's temporary. I'm talking more long term. You know, foods that are maybe heavily in fat or heavy in sugar. So the things that can cause like an inflammatory response. So ditch inflammatory foods. And that means, just like I said, high in sugar, high in fat. Keep a food journal. Maybe experiment with your diet if you feel like it's related. You can limit caffeine. Sometimes, even though we think that helps, sometimes it can just be a temporary fix. And then pay attention to how your sugar affects your body. So, like when you're eating really sugary foods. And then try smaller and more frequent meals. That's one of my favorite things because it kind of stabilizes out your blood sugar as opposed to having these large meals. Just having something very small and keeps you tied over to the next meal, and it kind of helps your metabolism too as well. Drinking more water. That's something I'm working on. And then as far as medications, when possible, take medicines that cause drowsiness before sleep. Not always can we do that, but if you can, if there's certain medicines that you're on, like on an everyday basis, and they make you drowsy, if you're able to do that, they say that taking a brief nap during the day, even as little as like 30 minutes, 15 to 30 minutes, can be super beneficial. Sometimes I think even just laying down and resting your mind and body for like even 5 or 10 minutes can make a significant difference. Do you ever do that? Anybody here on the call? Brittany, do you do that ever?
I called power nap. I used to do it in college all the time.
Did you?
Yeah. I would have classes all day on, I think it was Tuesdays and Thursdays. I don't really remember, but one of the days I had a hour and a half break, and I live 30 minutes from the campus. Well, 25 minutes. So by the time I would get in my car, drive home, it'd be, basically time for me to turn back around. So it just was a lot of wasting gas and really time. So I would study in my car or nap in my car, or sometimes I would go to the library too. They have these big beanbag chairs on campus, so a lot of people would sleep in those too.
Oh, man, that's awesome.
People are napping everywhere in college.
You got to sleep when you can, when you're up
Yeah.
late studying,
Yeah.
Oh, and then so we also have check with your provider about medication options if you're finding that your medicines are causing you sleepy, and try doing some extra physical activity. Sometimes getting up and moving. Whenever I'm like really tired, sometimes just getting up and actually starting to do something will
Doing
help you feel a
something.
little better.
And it makes you more
Yeah,
motivated too to do other stuff after that. Yeah.
absolutely. And then our last one here is lifestyle habits. And so we have kind of this first one here is getting up without hitting the snooze button, starting your day with the right attitude, and with a healthy breakfast. So you're laughing. Are you not a breakfast person?
No, I'm laughing at the snooze thing.
Oh, getting up without hitting the snooze. Honestly, I don't
My
know.
husband hits snooze at least 6 or 7 times every morning. It drives me nuts.
Well, and I put this on there, but I'm actually a snoozer myself. I have to admit.
Are you one of those people that sets the alarm like so what he does is he sets it like 30 minutes before he actually needs to get up because he knows that he's going to snooze it. So
Yeah.
he knows like he knows how long the snoozes are too. So he has it timed out how many times he can hit snooze before he actually has to get up. Just
Oh, I
set
do
your
that
just set
exactly.
your clock for the time you got to get up and get up.
Oh, I do, Brittany. I do because it helps me wake up. It's like an hour of snoozing.
His is like 30 minutes, I think. I don't think it's an
Oh,
hour, but
that's not too bad.
Carrie
It
says I do the exact same thing.
must be a common thing. It's not good. It's good for me, but like you said, your spouse, if they're not wanting that, after 30 years of marriage, Jeff's like, okay, he just goes with it now. But like, I don't know if you said you don't like it very much either. The snooze.
It drives me nuts, but like I mean, it's a small price to pay, I guess. He could
It
be
just helps
doing
me
worse
wake up.
things. It's just a little annoying, that's all.
And then here we have breathe, relax, and find enjoyment in your daily activities. And I think that's something so important to remember is just enjoying, the things that we do. Sometimes we get caught up in this fast-paced, busy life and we
Go,
forget
go, go,
that,
go, go. Yeah.
yes, we forget to enjoy what we're doing and where we are, like right now. And then here we have around lunchtime, balancing your meals and finding a way to help regulate your blood sugar. by eating foods that do help you with that, foods high in protein, complex carbohydrates, um, help with that. And spend time doing the things that you enjoy. Find at least one thing each day that you really enjoy doing. I mean, hopefully it's a lot more than that, but if you have a busy day and you're not really necessarily doing a lot for yourself, find at least one thing today to do for yourself. And then find an exercise routine that best fits your schedule and best fits your body, that type of thing. And then up here we have some just, I think, interesting things. So consider some non-habit forming supplements, things like melatonin or valerian. We talked about earlier about removing extra electronics from your bedroom. We also talked about starting the bedtime routine, meditation. If you've not tried that, that can be super helpful. And then sometimes I thought this was interesting, not eating after 7 p.m. so your body isn't working as hard during the night. Like, I guess your body has to work to digest the food. So if it's digesting food, it can kind of keep you up. And relaxation teas, that's one of my favorites as well.
Oh, yeah. Night tea.
Yeah. I love those. So in conclusion, basically, first of all, we talked about the vitamins. If you're not sure what your vitamin level is and you're fatigued, have your vitamin levels checked by your primary care or your bariatric surgeon. Take a multivitamin. Take your calcium supplementation. And here, if you'd like Brittany mentioned earlier, free samples, and we'll give you guys a link for that and tell you about how to get those here in a moment also as well. If you have sleep problems, find out what's causing it. Sometimes you can do something about it if it's sleep apnea, if it's the restless leg thing. Sometimes if you know what's causing your issues, you can actually do something to fix it. And then medical conditions, the same. Become aware of issues that are calling to your attention and make those lifestyle habits to change those. And then mental health, if you're finding that a lot of your energy is going out to deal with stress, deal with anxiety, it's draining you, find someone that you can talk to and trust to share things with and get some help you feel a little better today. And then down here we have intake with your diet and medications. Make sure what you're putting in your body. If you find that certain foods or drinks are making you more drowsy or contributing to your fatigue levels, take a look at that. And then again, with the lifestyle habits, finding a routine that works for you, a schedule, and making some of those habits more common. So we can change to have more energy and time dedicated to those things that relates to our happiest lifestyle. And so we're going to kind of move here on. Any questions at all? Anybody have any questions? Let us know what you've found to be the most helpful to combat fatigue, and type a question in our chat box or add a question box if you have questions for us.
Or if you have a nightly routine that helps you relax.
Yeah, we'd love to hear it. We'll give it a minute here. What's your favorite things, Brittany? What do you think helps you more than anything during the day?
Like before, to get ready for bed, or like just during the day in general?
To help with fatigue. To help, like whenever you notice that you're getting fatigued or you notice that there's an issue with fatigue. Do you have any special things to say?
Coffee. No, I'm kidding. I do try and limit my caffeine to only 1 cup in the morning. Now, the owner, though, of ProCare, he drinks coffee all day. Some people have to, though, I guess. What was I going to say? Oh, I like taking my dogs for a walk.
Does that kind of wake you up?
Yeah, because it's like you're outside, you're looking around, it's kind of relaxing, but it's also like it gets you moving. And then what I was going to say is at night, whenever I'm getting ready for bed, I like to read a book. Not on your tablet, not on your phone, a real book.
Mm-hmm.
Because it kind of, I don't know, like it's so relaxing that it just kind of gets you in the mood. It kind of makes you a little sleepy and just read a chapter and then, lay down and go to bed.
Yeah, getting in a routine of
Yes.
anything. You know, it could be as simple as brushing your teeth and putting your pajamas on. I know that sounds silly, or taking a shower, or like an actual routine and reading. You know, it actually just kind of prepares you for getting ready. And Brittany, we have a few minutes here. I'm gonna allow you to kind of share your screen. I'm gonna stop sharing, and I'm gonna allow you to share about our sponsor, and then
Okay.
also hear about how to follow us on Crowdcast, which is our forum that we're on right now. And if you follow us, you get notifications of upcoming events. So I'm gonna go ahead and stop
Okie
sharing. And also
dokie.
a little quote: be strong, be fearless, be beautiful, and believe that anything is possible when you have the right people to support you. Okay,
Let's go
all
to
yours.
share. Can you see that? It should be ProCare Health site.
Yes.
Okay.
Yes.
I'm going to go to the homepage because I want to show you guys where everything is at so you can navigate.
Sure. How
So,
did they get to Procare Health?
it's www.procare.now.com. And after I'm done, I can actually share the link for you guys too, if you're
Okay.
curious. So, this is the homepage. First, I'll just go over. Well, I'll show you where to get the free samples at first, because who doesn't like free stuff, right? So yeah, you just click this free sample, and Carrie, if you are on the call still, um, so yeah, it doesn't say these samples allow you to have your simple routine, ease of 1 month. Oh, and I meant to say too, by the way, Carrie, I don't know how many multivitamins you're taking a day, but what's nice about ProCare Health's bariatric formula is that it's a once daily um, formula. So it's just one and done. And a lot of people like to take them before bed. Um, or Brenda, when did you say you liked taking yours? Did you like yours before bed or it,
I've actually started taking mine again in the mornings. I was
in the
taking
morning?
them at night, but before bed, a lot of times people will say it keeps down the nausea. And I've
Hmm.
also tried one other thing, like the ProCare capsule, the one a day. I actually take my capsule and I open it up and I put it in food. Um,
Yeah,
and I do that because sometimes the gel cap just doesn't set right with me. It's supposed to dissolve very
sure.
quickly and rapidly, but I that's what I like doing.
Everybody's different. But yeah, so you would just fill out your information here. And then this is the box I was talking about, Carrie. If you have a specific flavor that you'd like to try of maybe one of the chewables, or if you know that you don't like chewables, you're more of a capsule person, you can put that in there too. And then if you have any calcium products that you would like to try, go ahead and list that in there too. And I'll show you guys where all of that stuff's at. So it's in this drop down box for products. So these are once daily, and the special 45 is too, actually. But the probiotics and the prenatal ones are twice. So you would take two of those in 1 day. And then to see our calcium supplements, those are in here. These calcium soft chews are pretty delicious. Brenda's favorite is the sea salted caramel. Mine is the cinnamon roll. And also, there's dinner mint, which is nice after dinner. It's like a nice little treat.
Yeah.
And there's a couple things I wanted to show you guys too while on the website because it's not just about the products. I mean, of course, that's probably the main portion of it, but we do have a blog too here for you guys. And then we also have handouts here if you want to look at some of our past events and we refer to any handouts that we have. It's going to be located on this tab right here. And these are all the topics that we have. So we also have some air fryer recipes. We did a cooking around the holidays live event. We also we did a meal prep one that a lot of people liked. If you're new and this is new to you, this is a really good resource for you guys to take advantage of, and it's all free too. So, and I don't know if Brenda said, but the Crowdcast channel is also free. And if you click on resources, we have a bunch of blogs here on various different topics for you guys too. So it's kind of like a one-stop shop for just supporting you guys on your weight loss surgery and your weight loss journey. So, yeah, I think that's it. Brenda, did I miss anything?
No, you want to share? We have about 4.5 minutes. Do you want to share Crowdcast?
Sure. Okay. Let me go to that page. Let me stop sharing this though. Click to close. Close video. Okay. I'll share the link real quick and then I'll share my screen and show you guys what it looks like too. Deborah said I get nausea sometimes as well. Yogurt helps.
That
Yeah, that
actually
makes
works
sense.
good. Yeah,
Because
I
it
like
probably
mixing with
coats your
yogurt.
stomach. Yeah, I did clean. Oops, I did click just once for multi-calcium 3 times. Okay. Let's see here.
Looks like Carrie put my 18-year-old daughter had weight loss surgery and her PCOS was resolved. Yeah, there's so many different conditions that are actually benefited by having weight loss surgery. So that's wonderful.
And even some people have their diabetes reversed
Mm-hmm.
too.
Mm-hmm.
Okay, share this one. Can you see that?
Yes.
Okay. All right, so the link that I just shared with you guys is actually our Crowdcast channel, which is what you're seeing right here. This says that we're on air now. That's because this is the event that we're still doing. Here are some upcoming events that we have. I'm really excited for Habit Changer series that we have coming up. Because I mean, no one's perfect. We all have habits that are probably not super healthy that should probably change. I know I do anyway. I can't speak on everyone, but
Mm-hmm.
and then we also do, like we were talking about before, we do monthly support groups too. And this month is on traditional and non-traditional ways of what was it? Is that
Uh,
right?
what was your question? I'm sorry, Brittany.
It's our support group coming up is on traditional and non-traditional ways to support healing and manage pain. So if
Oh
you
yeah,
are
yeah.
experiencing uh, maybe joint pain or just any kind of chronic pain, that would be a good one for you to sit on and listen on. And then we have all of these other ones that we did in the past, and you guys can watch these anytime at your convenience for free as well. So this one was really fun that we did with Maddie. She's really popular on Instagram. She has recipes that she likes to share, and she of course had weight loss surgery too. So we have some of these are interview styles, and some of them are kind of like today where it's more informational. Uh, Here's that magnesium one that we were talking about earlier. And we did an interview with Lauren. She had a baby after having weight loss surgery. And this one was really interesting with Dana about hypnotherapy.
And we
And
got about 20, 30 seconds.
okay, I'll wrap it up. But I mean that's basically it. There's a whole other second page on there too. So if you guys would like to check that out, please make sure that you do so. And if you have any topics, just let us know. That's all I have
Yes.
now.
No, thank you. Yeah, we love, like, we were looking at I think we have 38
You're
live
welcome,
topics
Carrie.
listed on there now. Yeah, thank you. So we're starting to upload to a YouTube channel. So we're going to be, ProCare is starting a YouTube channel as well. So we'll be having
Slowly
those
but surely.
uploaded soon and ready. So at this point, we're going to thank everybody for being here, and we're going to sign off and tell you all to have a wonderful rest of your day.
Mm-hmm. And
Thank
Carrie,
you
good
so
luck
much.
with everything.
Yes, so nice to meet all of you on the call.
Yes.
And we love you being here with us.
Alrighty,
So,
we'll see you guys
okay.
next week.
Okay, okay.
All right, bye.
Bye-bye.